Have you ever woken up in the morning and felt like taking your first breath of the day was harder than it should be? Maybe your chest felt unusually tight, or your breathing sounded a little noisy, or you needed a moment just to catch your breath before standing up. Most people ignore these signs, assuming it's just age, fatigue, or lack of sleep. But what if your body is whispering a warning that you shouldn't ignore? Because morning breathing problems are not random. They raise some of the earliest clues that your lungs are struggling long before clinical tests detect the damage. And today, we will uncover 10 morning breathing problems that may secretly reveal hidden lung disease, including one that doctors say almost everyone overlooks until it's too late. Imagine this: your lungs work non-stop, every second of every day, filtering air, oxygenating your blood, and keeping you alive without you even noticing. But inflammation, pollution, silent infections, allergies, smoking, and even stress can weaken them over time, quietly, slowly, and without noise until one morning, your lungs begin sending signals through the very first breaths you take. And that's why the morning is the best time to detect hidden lung disease, because lying down for hours changes pressure on your lungs, increases mucus buildup, and affects how easily oxygen moves in and carbon dioxide moves out. So let's begin with the first sign you must never ignore. 1. Morning chest tightness. If your chest feels tight the moment you wake up, that is one of the earliest red flags of airway inflammation. Imagine your airways as tiny pipes. When they swell overnight, the opening becomes narrow, meaning less air enters with each breath. Many seniors describe it as a weight on the chest or like needing to force air in. This tightness may point to hidden asthma, early COPD, or even the beginning stages of fibrosis. Here's a small test. If the tightness improves after you sit up for 2 to 3 minutes, it means your lungs are draining mucus, and that's a sign you should not ignore. 2. Needing deep breaths right after waking. Do you feel compelled to take several deep breaths first thing in the morning? This happens when your lungs struggle during sleep, often due to poor oxygen levels or stiff lung tissue. People often say it feels like my lungs aren't fully opening. This is commonly seen in early restrictive lung disease, especially in those with long-term pollution exposure. A tiny suspense loop. If taking a slow deep breath causes a mild pulling sensation inside your chest, that is an even more important sign. 3. Morning shortness of breath. Even while resting, if you open your eyes and feel breathless without moving, your lungs are not functioning efficiently. Common hidden causes include microinflammation inside the lungs, congestion from nighttime acid reflux, early heart-lung interaction, dysfunction, lower oxygen saturation during sleep. And here's the thing. Many patients don't notice this breathlessness because they assume it's normal aging. It is not. For morning wheezing or whistling sounds, a faint whistle, squeak or wheeze while breathing in or out is a classic sign of airway narrowing. Morning wheezing is often one of the earliest signs of asthma, chronic bronchitis, environmental allergies, early COPD. If you hear even the tiniest sound, your lungs are trying to communicate. 5. Coughing in the morning. A mild morning cough can be normal, but a daily morning cough, even a weak one, signals mucus buildup in the lower lungs. This is the most common early symptom of COPD, especially in former smokers, even those who quit 20 years ago. A small suspense twist. If your cough improves after drinking warm water, it suggests mucus thickening, another early alarm. 6. Clearing throat repeatedly after waking. Not exactly a cough, but a repeated clearing of the throat. This often means mucus was collecting in your airways overnight. This happens due to silent reflux, postnasal drip, early chronic bronchitis, allergic airway inflammation. Most people ignore this, but doctors consider it a key sign of hidden airway irritation. 7. Feeling like you can't fully exhale. Pay close attention to this one. If you can inhale normally but exhaling feels restricted, like air is getting trapped inside, that is a classic sign of air trapping seen in COPD and asthma. Try this simple check. Exhale slowly. If the last 20% of your breath is difficult to push out, your airways may be narrowing. 8. Morning mucus with a strange texture or color. Healthy lungs produce clear, thin mucus, but if your morning mucus is thick, yellow, sticky, foamy, excessively stringy, it may indicate infection, chronic airway inflammation, or early bronchiectasis. 9. Waking up tired or foggy. This may surprise you, but morning fatigue is a lung symptom. When your lungs do not exchange gases efficiently during sleep, carbon dioxide levels rise. High CO makes you feel tired, foggy, unrefreshed, heavy-headed. This is extremely common in undiagnosed COPD and sleep-related lung conditions. 10. Needing to sit up to breathe comfortably. If you feel breathless lying flat but better once you sit up, it often suggests hidden lung congestion or heart-lung imbalance. This can also be an early warning sign of pulmonary hypertension, fluid accumulation, reduced lung elasticity. This symptom is never normal and must be addressed. Practical solutions to strengthen your lungs. Here are clear-friendly, doctor-approved habits that significantly improve lung function. Morning steam inhalation for 2 minutes, drinking warm water within 5 minutes of waking. Gentle pursed lip breathing, avoiding cold AC air immediately after waking. Daily 8 to 10 minute walking routine. Sleeping with head elevation to reduce congestion. Common mistakes people make: ignoring mild breathing problems, thinking it's just age. Drinking cold water in the morning. Sleeping flat on the back, ignoring pollution exposure. Bonus tip: the lung cleansing morning stretch. Raise your arms above your head. Inhale for 4 seconds. Hold for 2 seconds. Exhale slowly through pursed lips for 6 seconds. Do this for 2 minutes daily. Lung doctors swear by it.